the care. So it's October, which happens to be one of my favorite months of the year. I love fall, the colors, the apple orchards, the sweater weather. I love it all. Except Halloween, which if you know me well, you know I do not love. My husband and I celebrate our anniversary in October, and my mom's birthday is in October too. So lots to love about this month. Speaking of my mom, many of you may not know that she's a breast cancer survivor. October also happens to be Breast Cancer Awareness Month. So in this video, we're going to discuss, you guessed it, breast cancer. So this is a video for my over 40 ladies, which I am not yet, but thanks to my mom, I get to be screened for breast cancer a little younger than most people. Thanks, Mom. First, let's talk a little bit about breast cancer overall. So 1 in 8 women will develop breast cancer in her lifetime. That's a crazy high statistic. So if you're sitting in a room with 8 women, you can imagine that one of them will get breast cancer at some point in her life. The other thing that is crazy to me is that if that cancer is able to spread to other parts of the body before it's detected, there's only a 26% 5-year survival rate. So that means there's almost a 75% chance that the person wouldn't survive 5 years. But if breast cancer is detected early, there's a 99% 5-year survival rate. 99%. One of the ways that we can detect breast cancer early is by screening for it. Screening means that we are looking for cancer before a person has any symptoms. So there are different tests used to screen for breast cancer, and they include a clinical breast exam, a mammogram, and an MRI. A clinical breast exam is a breast exam done by a healthcare provider. This is different than a self-breast exam. A self-breast exam is a breast exam you perform on yourself. So researchers aren't really sure if self-breast exams or clinical breast exams really reduce the chance of dying from breast cancer. However, it's still important, regardless of that, to know what feels normal and what doesn't. So I still recommend that all of my patients do self-breast exams regularly and have regular clinical exams as well. The most common screening test for breast cancer is a mammogram. A mammogram is an x-ray of the breast. This test can find tumors that are too small to feel. So even if you don't feel anything on a self-breast exam, the mammogram can still find those tumors. The thing about mammograms, though, is that if the breast tissue is dense, which is common in women under 50, the tumors are hard to detect. Dense breast tissue looks white on a mammogram. So does a tumor. So it kind of blends in. Still, studies have shown that women between the ages of 40 and 74 who have regular screening mammograms are less likely to die from breast cancer. Now, an MRI uses magnetic imaging to take these detailed pictures of areas inside the body, including breast tissue. MRI is used as a screening test for women who are at higher risk of breast cancer. So these would be women who have tested positive for the BRCA gene, which is the breast cancer gene, or women who have a strong family history of breast cancer. MRI is more sensitive than a mammogram, meaning it finds breast cancer more often than mammograms do. But it also has a lot of false positives. So many times the results appear abnormal when there isn't actually any cancer there. All screening tests have risks. They can all have false positive results when the test appears positive but there's no cancer. They can also have false negative results, so they might miss cancer that is there. False negatives happen more often in younger women because of that dense breast tissue we talked about. Mammograms can also be uncomfortable, which if you've had one, you know. Although I've had them and they aren't nearly as bad as I imagined that they would be. Despite the risks of screening, let's remember those statistics. The 5-year survival rate for breast cancer found in later stages after it has spread to other areas of the body is only 26%, compared to 99% if it's found early. I'd say the benefits far outweigh the risk here. So if you have insurance, it should cover screening mammograms every 1 to 2 years. If not, there are community programs available. Some imaging centers will also provide mammograms at a discounted rate for cash-paying patients. If you aren't sure you can afford a mammogram, make sure to contact me and we can work together to find an affordable solution. Be part of that 99%. So ladies, go get those mammograms. I hope you enjoyed this video. I'd love it if you would like and share it with anyone who you think might be interested. And I will see you next time.